This week, Governor Janet Mills relaxed more rules to make it easier for Mainers to see a healthcare provider using telehealth services. That also includes allowing out of state providers to see patients remotely without having a Maine license. News Center Maine's Vivian Lee is here now to tell us how remote visits are helping patients not only with their concerns about coronavirus, but with other medical issues as well. Viv?
Well, Cindy, just like I'm talking to you right now from my kitchen in real time is how a patient can interact with their doctor. Telehealth visits provide intermed patients with a range of services from questions about a suspected COVID-19 case to prescriptions without having to travel to a healthcare facility. With social distancing so key, the doctor's office is now a place to avoid. But at Intermed, interacting with a doctor in real time is just a click away.
It sounds like you're having symptoms that are consistent with a common cold, which also can be similar to the coronavirus symptoms.
The medical group, which has about 100,000 patients, has converted 40 exam rooms at their offices in Yarmouth and in Portland into telemedicine suites. Patients can sign up for visits through Intermed's patient portal. Blood pressure checks, diabetes screenings, breathing concerns, and getting a prescription can all be done in real-time visits.
I'm going to send in a cream for you that you should use twice a day.
But patients with serious medical problems are encouraged to be seen in person. Dr. Scott Patch and other physicians have been talking to a lot of patients with a variety of symptoms, including cough, fever, body aches, that could be associated with the coronavirus.
But now we know there's a lot of nausea, vomiting, diarrhea associated with it, loss of smell. So there's an evolution of symptoms there that we can help patients navigate.
Intermed is providing testing for COVID-19 at its offices in South Portland, but officials say supplies of the tests are limited. High-risk patients are also being seen here as well. Now, Dr. Patch says patients who are under 60, healthy, and do not have severe symptoms, testing for the coronavirus may not be available for them at this time. Instead, they'll be encouraged to self-quarantine, practice good hand washing, but if their symptoms get worse, they're urged to call their doctor.
If you're over 60 with chronic pulmonary disease, you may be tested because that's a patient that if you test positive, we may need to call you every day or do something every day to make sure that we catch you before you get too sick and end up in the emergency department.
Well, right now, about 10% of Intermed's patients are testing positive for the flu, which is active right now, and doctors are advising these patients to stay home and self-isolate to better protect the community. Now, we'll have much more information about how patients can sign up in the portal at Intermed for these telehealth visits. Just going on to our website and social media apps, we'll have that information for you. Back to you, Cindy.